Let's start with a look at the current paradigm when it comes to weight loss. So here we have the calories in, calories out paradigm, right? Sometimes called CICO, calories in, calories out. Basically, eat less and move more. And it also implies that if you're gaining weight, if you're fat, it's obviously because you eat too much and you don't move your body. You're just sitting around doing nothing. Basically, you're lazy. That's what this paradigm implies. And many of us know this just isn't accurate. It's okay to question it because it's not accurate. We have moments where we gain weight, yet we did not change our diet. Something else happened maybe internally. In this model, we have the calories in, which is food you're eating, and that's going to give you energy. And then if you're spending energy, you can balance this out, right? That's what the paradigm says. It's kind of like very linear, as if it's a mathematical equation, which of course the body is completely complex and there's nothing that's a single lever mechanism. There is no perfect equation. It's a complexity system with a lot of moving parts. So here we have the weight loss math. And in this concept, calories in versus calories out dictates weight change. Also, you have to consume fewer calories than you burn for weight loss. A calorie deficit is essential for losing weight, according to this paradigm. And when you balance the energy intake and expenditure, that's how you're going to reach your goals. But as we were saying, it's like, what if you have a thyroid issue? What if you have an underlying gut issue? What if you have something going on internally that's affecting your metabolism? That's going to change how much you have to spend to get that same result. And it may be unapproachable for some people. There are patients that we have who are very large, 300-400 pounds, and they are not overeating. There is a metabolic state that is challenged internally, and it has to be understood, it has to be treated in order for them to get success. And if you just try to white knuckle it through decreasing the amount of food you're eating and trying to move your body more, it's really unapproachable. And it results in failure because this concept just doesn't work for them. But at the same time, if you were to be put on an island where you don't have any food and you were starving, you would in fact lose weight. When somebody has their stomach stapled or some sort of bariatric surgery, they are forced into a caloric deficit and they start to show weight loss. They are eating less and they're losing weight. So there is some truth to this, but we want to kind of dig deeper because the last thing we want is a miserable experience or one in which we're getting sickly while we're losing weight, and it has to be actually doable.